The advocacy strategies we will use will be a combination of advocacy launch and also a community champion. The advocacy strategies will need to contain a thorough understanding to be effective, so our team will also focus on education, policy change, support for cessation, and institution collaboration. An advocacy launch would take a similar approach to life education, or better known as Healthy Harold. Life Education has been running successful health promotion programs with Queensland schools for the past 34 years. A separate health program may not be necessary, but to include a vape and e-cigarette focused program would be beneficial. It is also to be noted that Life Education primarily provides programs suitable for primary school students. While this is useful for promoting a healthier lifestyle among children, an advocacy launch among high schools could create further discouragement from using these tobacco products. A useful model for consideration is Black Dog Institute and the resources and programs they provide for promoting mental health and well-being in workplaces, but also among teenagers. By providing visually appealing resources, but also engaging presentations and presenters supported by relevant research, Black Dog Institute's approach to health promotion is one to be recognized. A community champion would take a similar approach to Deadly Choices, the Indigenous-focused health promotion organisation. Deadly Choices have ambassadors primarily from Australian sporting teams. These ambassadors are seen on advertisements as well as attending events. A notable event organised by Deadly Choices is the yearly Junior Murray Carnival, which requires participants to have had a recent health check and solid school attendance. The event is also sugar, alcohol, and smoke-free. By engaging with sports stars who have given up vaping or have been affected by vaping and having them tell their stories to young people could be impactful on adolescents. Sports stars may have a greater sphere of influence when compared to health educators in school. Encouraging young people to stop vaping reflects several public health values that are central to promoting and for the well-being of individuals and communities. Here are some public health values that align with efforts to discourage vaping among young people. Prevention is a fundamental value in public health. By discouraging vaping among young individuals, the focus is on preventing the initiation of harmful behavior that can lead to addiction, health problems, and long-term consequences. Prevention strategies aim to promote healthier choices and reduce the burden of disease and injury. Public health values equity and aims to ensure that everyone has an equal opportunity to achieve good health. Discouraging vaping among young people aligns with equity principles by addressing disparities and promoting equal access to accurate information, resources for cessation support, and a healthy environment. It seeks to protect the health and well-being of all young individuals, regardless of their background or circumstances. Empowerment is about enabling individuals to make informed decisions about their health. By educating young people about the risks of vaping, providing them with resources for cessation, and creating supportive environments, public health efforts empower individuals to take control of their own health and make choices that align with their well-being. Public health values collaboration and recognizes that addressing complex health challenges requires partnerships across sectors. Discouraging vaping among young people involves collaboration between public health agencies, educational institutions, community organizations, parents, and other stakeholders. By working together, these entities can pool their resources, expertise, and influence and create comprehensive strategies for reducing vaping rates. Discouraging vaping among young people reflects these principles by respecting individuals' autonomy to make healthy choices, promoting actions that benefit their well-being, avoiding harm from the adverse events of vaping, and addressing health disparities. Encouraging young people to stop vaping addresses broader social determinants of health. Here are some of them. By promoting awareness about the risks and negative health effects of vaping, young people can make more informed choices about their behavior. Education campaigns can provide accurate information about the dangers of vaping, including the impact on lung health, addiction, and potential long-term effects. This knowledge empowers young individuals to protect their health and make healthier decisions. Vaping often spreads through social networks, and peer influence plays a significant role in determining whether young people start or continue vaping. Encouraging young individuals to stop vaping can help disrupt these social norms and create a healthier peer environment. By promoting positive peer pressure and encouraging healthy behaviors, we can reduce the prevalence of vaping among young people. Society's perception and acceptance of vaping can influence its prevalence among young people. By actively discouraging vaping and promoting a culture that prioritizes health and well-being, we can shift social norms away from vaping. This can be achieved through public health campaigns, media messaging, and community initiatives that highlight the risks of vaping and advocate for healthier alternatives. Restricting the availability of vaping products, particularly to minors, can be an effective strategy in reducing vaping rates among young people. Policies and regulations that limit the marketing, sales, and distribution of vaping products can help create a less accessible environment for young individuals, reducing their exposure and temptation to start vaping. Encouraging young people to stop vaping involves creating supportive environments to help individuals quit and prevent relapses. This can include access to cessation programs, counseling services, and peer support groups. By providing resources and building a supportive network, we can assist young individuals in overcoming addiction and maintaining a healthier lifestyle. By addressing these broader social determinants of health, efforts to discourage young people from vaping can have a positive impact on their overall well-being and reduce the prevalence of vaping-related health issues. While these ideas sound promising, it's important to note that without extensive research into the impacts of vaping, it will be challenging for these strategies to hold weight. Unfortunately, data will not be available for a number of years due to vaping and e-cigarette use only starting within the last 10 years. We do, however, know that there can be similarities in the approach taken to curb vaping when looking at government's past actions to mitigate cigarette use. This can also be useful in understanding modern tobacco companies' next steps in advertising and promoting their smoking products. Thank you.